Good morning, you're Georgina White, is that right?
Yes, that's my name should be, yeah.
Hi Georgina, my name's Susan Francis-Plunkett. I'm one of the massage therapists, the remedial massage therapists here at Line Time Therapy. I noticed you've made an appointment to come in and discuss your knees today.
Yes.
I'm just reviewing your client history form that you've completed, and I've noticed that you've got some chronic pain relating to your knees, is that correct?
Yes, I've had ongoing knee issues for about a decade now. And yeah, it's just something that I've always been kind of dealing with the pain from that.
I noticed that you've actually entered that you've got a degenerative disease called patellar ulcer.
Yes, so my kneecaps sit quite high on both knees, and that has caused some chronic issues.
And loss of cartilage.
Yes, yeah.
That's been quite difficult for you, I would imagine, as a person of your age group.
Yeah.
Yeah, so, and also problems with walking, kneeling, bending and squatting.
Yeah, so pretty much all those types of activities kind of inflame my knees and make it quite painful, so I tend to avoid most of those if I can.
Okay. And you've noticed, you've said here that you do have some abdominal or digestive problems as well, is that correct? Or?
Yes, I have, I just have quite quite a sensitive stomach.
Okay.
So
is that mainly with certain sorts of foods? Or?
Yes, so I try to limit those. I try to follow like the low FODMAP diet most of the time if I can.
And have you had a medical assessment of that?
I have had an initial consultation with the gastroenterologist, and I'm yet to follow up with them.
Okay, and there's a plan to follow up with them about that?
Yes.
So,
yes.
Good. And you've got some allergies, I noticed, to amoxicillin, is that right?
Yes.
And lactose.
Yes, that's correct.
And that's all integral with the abdominal digestive problems I've got. And I noticed that you've had a couple of arthroscopies. When were they? Because the dates are not listed there.
So I had my right knee done in 2012, and I had my left knee done in 2020.
Oh, okay. And how did you progress after those?
After the right one, there was obviously quite a distance between the second one, so there was no issues, really major issues that needed to be dealt with surgically. However, following the left knee arthroscopy last year, it's been decided that I do need to have additional surgery on both knees, actually.
And I noticed that that's going to be a tibial osteotomy, is that right?
Yes, that's going to address the patellar ulcer and hope to preserve the cartilage that I have remaining and stabilise my knee joint.
Fantastic. And who's doing that for you?
Adrian Trivett. He's
I've heard of Dr. Trivett, Mr. Trivett, rather. Yeah, he's very good knee surgeon, I've heard. Out of Cabrini, is that right?
Yes.
That's good. Okay. So your goals, you're with a physiotherapist at the moment and recommending a little bit of deep tissue to the quadriceps and releasing the thigh muscles a little bit, working on that area, get a bit better range of motion and comfort level for you.
Yes.
And your local doctor is Karen Wilson, relieving, strengthening quadriceps. Okay, that's fairly straightforward. And the things that relieve your pain is when you're resting, you do your physiotherapist, and when you're on the bike, that seems to be helping you.
Yeah, that was recommended by my previous orthopedic surgeon.
Not a problem at all. Have you had a massage therapy done before?
I've had a little bit of massage, really mostly through the chiropractor though, not as a isolated. Yeah.
So as you understand, what I do, I'm a remedial therapist, and we do targeted therapies generally on problems. So it's kind of like not like a spa therapy or anything like that. And we tend to work quite firmly in different areas. But what I'll be relying on you is for you to convey to me, I don't want you to be in excruciating pain. Sometimes we need to go firmly, but we don't need to make you feel sick with it. You know what I mean? So it's up to you to convey to me when you're not comfortable at any time, or if I interpret from you that you're not comfortable, I will back off. But never feel backward in coming forward and telling me that you're not comfortable or we need to just take a bit of a moment. There's no problem with that. I noticed that you've gone through all of the consented treatment. Was there anything that you wanted to clarify with me about that? You understand that I'm qualified, that I practice within a evidence base, and that we make sure that your privacy and confidentiality of your information is always high on our priority list. We make sure that occurs within the Privacy Act. So the other thing I just wanted to let you know is that we'll probably do treatment today. We'll take up to about an hour to do that treatment today, once we've done an assessment of the range of motion and recorded all those details. So about an hour. You're not actually pressed for time today. You don't have to be anywhere. An hour is okay for that. Right. And then probably in terms of like moving forward, leading up to surgery, we've got about 3 months before surgery. So I'm thinking that potentially we would value from every 10 days to 14 days in terms of treatment. And in between time, I'll give you a strategy about to add to your physiotherapist's exercises. And actually, I'd like to see you get into the water and do some weightless type of exercise as well. So what I'll do now is, as you can see there, there's a toilet adjacent to the treatment room. If you need to use a loo, feel free to go in there. There's a place for you to hang up some clothing if you'd like to. You don't need to strip off completely, just the lower section, but leave your underwear on. Come out onto the warm table and you can lay on your back and there's a pillow there and some towels that you can drape over yourself. I'm just going to step out of the room and do some administrative stuff with the history. I'll only be going for about 3 minutes or so, and then we'll come back and we'll start the treatment. So is that okay with you today?
That sounds great.
Excellent, no problem at all. Excellent, I'll just go out and I'll see you in a minute. Thank you so much. Bye. And